As a gastroenterologist, I know it might be awkward for some of you to talk about your poop, but not for me. I'm here to normalize all things related to your gut health. Now let's break down some of those burning bathroom questions. So I have some questions here. Let's see what we got. How much gas is too much gas? Oh, I get this one a lot. Gas is actually caused by a byproduct of bacterial fermentation in the gut. So basically, it can produce pretty embarrassing moments. It can cause abdominal pain. It can cause distension, meaning your belly gets a little big and swollen. Essentially, if you're having more than 21 episodes of gas, such as farting or irritation, burping, I would seek out and speak to your doctor regarding it. Are coffee poops a thing? If so, why does it happen? Basically, coffee is a stimulant. It will actually cause your muscles in your gut to contract more, called peristalsis, and actually will make you want to defecate more frequently just because of the natural nature of caffeine. Why do nerves or anxiety cause me to go more frequently to the bathroom? Nerves and anxiety are all related to the gut-brain axis. You would probably go more, let's say if you're anxious or nervous, just because of the fight or flight response. It actually causes you to secrete certain hormones that causes your gut to contract, leading to more frequent bowel movements. Why is it that when I'm on my period, my bowel movements are different? So usually women, when they're on their menstrual cycle, their bowel movements are different because of the hormones being secreted during that time. For example, usually prior to your period, you have increase in prostaglandins. And prostaglandins, what they do is they stimulate smooth muscle contractions, such as in your gut, that actually makes you want to go more frequently, that urge to go. And that can vary throughout your cycle. So you could either be overly stimulated, or even when the prostaglandin decreases, you could actually have slower bowel movements, and it could actually lead to a little bit of constipation. Is it normal to have mucus or blood in my stool? For the most part, it's never normal to have mucus, excessive mucus, or blood in the stool. It could actually point towards certain conditions such as infectious, inflammatory conditions that we need to evaluate. The most serious would be polyps and colorectal cancer. How frequently should I be going to the bathroom, and when is it a topic of concern? You know your own normal. Sometimes it could be once a day, twice a day, as often as 3 times a day. However, if you're having too many accidents, too many frequent visits to the bathroom, let's say more than 3 watery diarrheas, or not as frequent as once a week, that's a topic for concern. Why does my poop sometimes float or sink? So poop floats or sinks depending on the density of the stool. For example, stool is usually more denser than water. So when you have more gas, sometimes more fiber, it can float. If you don't have that in your diet, for example, not as much fiber, it could actually sink. When I'm constipated, does that only mean I'm dehydrated? So constipation in itself can mean that you're dehydrated. However, very excessive constipation, chronic constipation, needs to be evaluated to rule out certain things like obstructive things like masses or cancer. What color should my poop be, and is there a normal shape I should have? So this is a very important question I get asked a lot. So your stool should actually be brown in color and actually should be shaped like a sausage. It should be long and sausage-like shape. So it could have some cracks, which could be normal, but for the most part should be smooth. Certain conditions can cause the stool to be too hard and lumpy. That's what we call Bristol type 1, or very, very watery, and that's Bristol type 7. So it's very important to take a look at the consistency of the stool, of your poop, and then tell your doctor what you're having. The color actually could also point to certain things happening within your gut metabolism. So it's certain foods that you eat, as well as certain conditions that you can have. Well, I hope some of these questions help bring to light some very important topics and destigmatize talking about your poop.